both what you think is, when we think about alignment, right? System alignment, what do you think is missing? And what do we need to make sure we address in order to achieve successful alignment? So whether that's, a different partner or just how the partners currently show up, or their tools or resources, whatever you want to throw at us. And I'm just going to go from left to right on my screen. So Carmen, I'm going to ask you first.
I think probably state level planning with all the stakeholders. I think some examples are out there, but places like the center will really push out best practices. I'm so excited that this is coming from CSH and is going to be an available resource to share those best practices. What I really hope folks do is see models that are working, take that back to their state, and then create um, groups with all the different players, with all those different resources, and that strategically plan out the funding and the policy that's needed with people with lived experience at the table, of course. If that's happening throughout, if we're really pushing folks to participate, hospitals to participate, everybody's got a stake, and we could be so powerful if we align together and bring all those systems together.
Amioka.
That's how that's how one of my relatives used to call my name. My ears moved.
I do. I'm sorry about that. So
Can
what do you think leaders need to start doing or doing differently to move this work forward?
identify all the leaders.
Hmm.
Identify them.
Mhm.
Identify all the leaders. And if you don't know all the leaders, then ask other people about the leaders. And if they don't know, ask somebody else. Identify all of them and bring them all to the table.
Nice. That makes sense.
Mhm.
Margot?
I think we really need to make sure that our housing systems that are sort of caring for folks or permanent supportive housing have enough healthcare alignment so they can meet the needs of the people in them. We've talked about the population is aging, is frailer. There's a high level of behavioral health needs as well as physical health needs, as well as functional health needs. And I think too often our housing providers are asked to do the unattainable or unrealistic with where they just are not staffed appropriately. They don't have enough case management on the ground because the payment models aren't there. They don't have enough nurses or nurse practitioners or, behavioral health providers working along them because we really do know what works, but we're often not actually doing that in a way that would frankly be unacceptable within the healthcare system. In the healthcare system, we never take someone who needs the ICU or hopefully never and put them in a skilled nursing facility. Like we try to match the the resources to someone's needs. So I think there's a lot of work to be done there, and that's going to come through alignment. That's going to come through the healthcare system, who frankly knows how to work with Medicaid, who knows how to restratify people coming to the table. I think we need to do a better job of earlier on recognizing the very few people who actually do need a more structured environment that can be realistically provided in PSH and be sure that those folks get there. But I think we also need to not prematurely do that because sometimes I think what we do is we understaff PSH and then we say it's not working when actually it would work if we actually, and then we pull people into a higher level of care, which is the most expensive, most restrictive part of our system. When actually, if we were appropriately providing the staffing that people need, they could thrive in a less restrictive environment. So I think that's sort of the work ahead of us. And I think, as Sarah said, we are facing so many headwinds, but we can't give up in advance. We need to keep pushing for what we know is right. I think if we have made so much progress. Like I'm old enough to have seen where we were 30 years ago and where we are now. And it's thrilling to see that we're having these conversations on the regular, that Medicaid is doing this. But I think there's much more work to do. And one of those is not only to expand our housing so that we're not leaving people out there for 10 years while they wait for a housing placement, obviously. But on top of that, we need to be better showing up as a healthcare system to allow us to match the needs as they are and to make sure that everyone can thrive and that people can thrive in the least restrictive, most humanistic system that we can do, really playing into the tremendous strengths of the residents, the peers, and the like.
Right. Sarah.
Well, that was such a great summary, Margot, and collaborators. I think I'll just wrap it up by saying, yeah, really do think that we feel very alone in this work often, and we don't need to feel that way. This is something that lots of people are struggling with across the country and in our own communities. I do feel like we need to be thinking about, how do we create an ecosystem model that allows us to use our strengths, and how do we create funding opportunities for that? I think health systems especially need to be thinking about I think health systems sometimes are sort of insular, and we need to be asking our partners in supportive housing, in homelessness services, what can we be doing to support you? Sometimes we have expertise that could be important around some of these challenges with Medicaid. How can we support our partners during these really tough times? But I'm also really excited about the National Center, because I think that sharing strategies, ideas, evidence with one another is going to be so important as we move forward.
All right. Well, thank you for that. And thank you all for helping us to launch the center. I think if we had a question whether or not there was a need for the center, you all answered it for us that, yeah, there is a need. And I'm very happy that we could have this conversation today. We started out by talking about this kind of the state of the land right now and what some of the challenges are. We talked about, systems alignment, what's not working, and how do we improve it. And I think one of the things that I heard a lot about today was the importance of a community-wide response, a statewide response, that it can't take one system is not going to solve the problems, and we need more people at the table. And while there are a lot of challenges in front of us, there's also a good number of things that we can point to that communities and people are doing every day that's working. And we need to continue to lift those things up.